Mr. Binoy Prabhakar, Mr. Vikrant Shrotriya, and all the distinguished delegates who were part of the summit today, members of the medical fraternity, researchers, patient advocates, and representatives from NASCO, ICMR, UNICEF, and most importantly, Team HT Media. Thank you very much for having me here today. It's both my privilege and my responsibility to join you all for this very important National Sickle Cell Summit, which is hosted by the HT Media Group, because this event is an attempt to bring the much needed attention to one of India's most widespread and invisible health crisis, which is the sickle cell disease. And it is often called the silent disease, not because it doesn't speak, but because we as a society, as a nation, or as the world haven't listened enough to it. My dear friends, sickle cell disease is not just a clinical burden, it's not just a genetic disorder. It is in fact a social, economic, as well as a generational burden. And for long, it has remained under radars. Despite affecting millions of people, especially those coming from the tribal and the marginalized communities, and in India, across 17 states, there's a huge population which is being affected. It still remains under-recognized and under-reported. For patients, the journey of a sickle cell disease begins with unexplained fatigue and pain in the childhood, which continues till adulthood and then becomes a lifetime of health struggle. And it is not just the patient who gets affected, it is the entire family who has to suffer. Children continue to drop out of schools because of frequent hospitalizations, adults are unable to work, and parents continue to live in fear that they may have passed on the gene to the next generation. So this is certainly an issue which deserves all the urgent attention. And the good thing, encouraging thing is that despite being a genetic disorder, sickle cell disease is preventable and it is manageable. So it's important that all of us come together and start working in the direction of creating a sickle cell-free India. I'm happy to say that under the visionary leadership of our Prime Minister, Shri Narendra Modi ji, we launched a very bold and time-bound initiative, the National Sickle Cell Anemia Elimination Mission in 2023 from Shahdol, Madhya Pradesh. And under this mission, we have decided to screen 7 crore individuals in the age group of 0 to 40 years across 17 different states. So starting from Uttarakhand to UP to Bihar, Jharkhand, West Bengal, Odisha, Chhattisgarh, Madhya Pradesh, Telangana, Tamil Nadu, Karnataka, Gujarat, Maharashtra. All these states, there are districts which have a high prevalence, and we are conducting the screening of 7 crore people on a mission mode. And I'm happy to say that we started this mission in 2023. We are standing in 2025. Our target was 7 crore people. We've already completed the screening of 5.8 crore people in the country. And 2 crore 54 lakh people have been distributed their sickle cell status cards. More than 2 lakh people have been identified with the disease, and more than 16 lakh people have been identified to be having the trait. And when we look at the performance of the different states where the screening exercise was carried out and this program is being implemented, the state of Chhattisgarh has conducted maximum screening in the span of 2 years. And it is very highest number of disease patients and highest number of patients have been found in the state of Odisha. So that is a cause of concern for us. But we are glad that the state governments are working very passionately towards National Sickle Cell Anemia Elimination Mission. Apart from screening, we are making sure that after screening and after the cards are distributed, the patients who are found to be diseased, they get quality care, they are put on treatment, and counseling becomes very important. Not just for patients, but also for their support groups, but also for social organizations. So that is something which we are encouraging the states to hold for all the SED affected patients and their families. And you also understand that creating awareness is very important because a large number of people in the country still don't know about the disease. They don't know what's the difference between a carrier and a disease. There are mothers who don't know whether they're actually carriers. And a lot of families, they do not want testing, they do not want to go for screening because there is immense amount of stigma associated with the disease. So this hinders testing. So IEC efforts are very important to break down these stigmas, to educate people, and to provide them the moral support so that they undertake screening exercise, they cooperate in the screening exercise, for which we are rigorously training our frontline health workers in the states, with the union government and state government. We are working together to make sure that our ASHAs, ANMs, who are actually given the task of screening, they are rigorously trained and they are able to provide compassionate care in the remotest of areas. And there is mandatory screening which is being carried out at our primary healthcare facilities and the Ayushman Arogya Mandirs today. There are mobile health vans which are specially deployed in the tribal areas so that people have access to screening facilities. So all these efforts are being undertaken because we want to create a sickle cell disease free India by 2047. And here, everybody's role becomes important. So it is the civil society, it is the doctors, it is the patient advocates, it is media, it is policy makers. Everybody's effort becomes important because it is a collective goal. And we all need to work together. Ministry of Health and Family Welfare has come up with an SED portal also. So every patient who's being screened and identified as carrying the disease is registered on the portal. And there is a treatment and follow-up module that we have developed so that the continuity of treatment and management for those patients who are registered on the portal is maintained. All that exercise is being carried out. I'm glad today this summit is being hosted and all of us have come together. I would like to acknowledge the contribution, the role that all of you are playing, and especially our sickle cell disease warriors, because it is our sickle cell disease warriors who have actually lived up, and their lived experience is a very powerful data for us. No effort for sickle cell elimination can actually be complete without their insights. So everybody who's here, I'm sure some SED warriors are also being invited here today. Everybody who's present here in this gathering, I would urge you to listen to their voices carefully. It's important, the insights that they give to us. It will help us in further strengthening our efforts in eliminating this disease from our country. I also take this opportunity today to sincerely appreciate the effort that has been made by the Hindustan Times Group. You are acting like a force multiplier in this mission because this is an issue, as I said in the beginning, it's been a silent disease. Not many people still know about it. So you are bringing this issue out of the textbooks and the policy documents into national consciousness. And your journalism is actually saving lives. So I just hope that this forum that you have created today, it continues to be a catalyst of change. My dear friends, all I can say in conclusion is that sickle cell disease is a genetic disorder. But preventing it, addressing it, managing it, that's a societal choice. And that is the choice that each one of us should make, whether we as policy makers or you as media or healthcare practitioners or researchers or the families themselves. We have to make up our mind that we will shift from being reactive to proactive. We must intensify our efforts in generating awareness and mobilizing community and supporting these families so that more and more screening is done, more and more people can be put on treatment, and we can save so many lives. So today is an occasion for us to pledge that no child will suffer in silence because of a sickle cell disease. No mother would remain unaware of her carrier status, and no family would be pushed into despair because of this disease. So this forum, this summit, this exercise shouldn't just be for dialogue, for conversation and exchange of ideas. It should be a call for action. And I'm convinced when all of us decide to march ahead with science in our mind and compassion in our heart, we will be able to create sickle cell anemia free India by 2047. And with this, I congratulate Hindustan Times Group once again, and I thank you all for your patience. Jai Hind.